esthetician, Dr. Jason Zimmer's office in West Hollywood. Right now, we're currently day 1 post-laser with our patient from last night. He is currently doing some vinegar soaks to kind of help get rid of any extra heat that still may be on the skin, along with any kind of little, dead skin that we might need to take off. So we're currently going to take off the patient off the vinegar soak. He is currently really peel. He's about to really peel. His skin is going to start to lift off. So we're currently, all this right here is dead skin that we're already removing. It's day 1. So the patient feels pretty sensitive, a little raw because, Dr. Emer really went a little aggressive on his skin, but it's definitely to give him the best result that he needed. We went ahead and prepped his skin with a Cosmetic peel to kind of help get rid of any pigmentation, any dead skin cells that were on the skin, and now with the laser is going to come in and go ahead and take care of any leftover scarring that was still left over from the peel. So currently, this patient is going to have maybe a downtime for about 14 days. He will be coming back daily for oxygen facials, and then he's going to maintain his results at home with the skincare. ¿Cómo te sientes?
A ver, un poco sensible, pero está un poco incómodo, pero no es dolor, es como un poco de que está caliente de la cara. Entonces no, pero ya, no es de ahí.
Okay. So patient said, he doesn't feel any pain. It's not pain. It's more of a tightening feeling and heat that he feels on his skin. Which is not feeling pain is a good thing if you ask me. Now we're going to pretty much going to go ahead and clean the patient's skin with Dr. Emer's foaming polish. And the foaming polish is going to help to make the skin peel with using some enzymes to kind of help get rid of dead skin cells. So we're going to go ahead and mummify our patient again. Do we have any questions or anything?
No. Okay. Let's see. We have some people asking. This is the person from yesterday. Yes, guys. This is the same patient. He did the laser, the subcision, the Bellafill, all that treatment. Is this damaging the skin like a bad burn?
The skin is designed to heal itself, and then the skin will pretty much rejuvenate itself and get smoother with time. This is pretty much is a very controlled exfoliation that we did with the laser. So in regards to damaging the skin, we're going to go ahead and build new collagen. So it's something that pretty much helps the skin look youthful and rejuvenated. If you follow the skincare and the regimen, you'll be perfectly fine. This is for someone who has really deep acne scarring, really bad irregular texture. We so far have done a pretty good improvement with doing some chemical peels. Now we're going to get a greater improvement by doing the lasers and the skincare.
So what happened to his face? He did CO2 yesterday.
Yeah, he did CO2, he did
subcision, Bellafill, TCA. Did a lot of treatments yesterday. There was to treat acne scarring and to shrink the pores on his skin. How long will his skin be peeling and have this aggressive damage for?
For about 14 days, maybe 21 days. The skin is going to pretty much exfoliate, rejuvenate, and pretty much get smoother within time. As time goes on, more and more collagen is going to start building, and his skin is going to start flattening out and getting smoother. Using the skincare at home like Cosmetic 2, Hyla B, AOXC from EMERAGE Skin, along with the foaming polish, is going to definitely help give his skin the vitamins and the nutrients that we pretty much need to kind of help rejuvenate the skin and get it back to normal.
Do you have any products we should go through right now for him?
Products? Yeah. So, as this is on the skin, patient's currently using our Hyla B, which is hyaluronic acid at 4 different molecular weights, which pretty much means that we're pretty much targeting hydration in 4 different levels. Right after that, we're doing a 20% vitamin C. The vitamin C is going to help brighten up his skin, rejuvenate his skin. And then we're getting into our stem cells. This is a bone marrow stem cell extract combined with the refit face. They're amazing packages. So currently we're cleansing the skin with our patient. ¿Cómo estamos? Bien, perfecto.
Is carbon laser bad for the skin?
That's something you would have to come in and speak to Dr. Emer about, or one of our nurses. Yeah, it's not a laser that I'm familiar with.
Let's see what's coming off.
All dead skin that we're currently removing off the skin. So, you know, it's a process to remove dead skin, but this is one of the best ways to do it. Instead of, you really don't want to rub your skin when you're doing post laser. Mind you, this is CO2, which is one of the strongest lasers that we have in the country, which is pretty much designed to treat acne scars.
Is it okay if the patient uses the vitamin C serum because it is also an acid and can irritate the skin while healing?
Dr. Emer's vitamin C is a very stable vitamin C, so it won't really cause any kind of irritation. What I mean by that is, in regards to using vitamin C, it's a clear vitamin C, which means it's a very stable form of vitamin C at a 20%, where other vitamin Cs, you know, oxidize within time.
No, he's not a burn victim. Yeah, he did CO2 laser resurfacing yesterday along with other treatments for acne scarring.
¿Cómo te sientes ahorita?
Sí, la piel está un poco...
Ya se está calmando lo caliente, ¿verdad?
Ya no se siente tan caliente.
Ya se siente más suave, más fresca. Perfecto. El paciente se hizo un láser. Ahorita estamos haciendo un tratamiento de oxígeno que le va a ayudar a rejuvenecer la piel. Los faciales de oxígeno. Okay. Pero ¿no te duele nada de eso? Perfecto. ¿No le duele la piel? So meaning it's saying that it doesn't hurt.
Was it a fractional or fully ablative CO2? He is going to have amazing results.
Yeah, he's gonna have beautiful results.
CO2 is an ablative laser, if I'm not mistaken.
Correct.
So now what are you doing, Jonathan?
So we're pretty much getting ready to do our oxygen facial.
And what is this that we're putting in there?
This is a group of vitamins from A to Z, along with hyaluronic acid on the skin. We are going to go ahead and pretty much use the oxygen to help rejuvenate, to restore his skin. Oxygen's a great way to, you know, it's even a great facial for anyone who wants like a really red carpet glow, a nice quick pick me up. In this case, we're using the oxygen to allow the skin to heal.
Now what should he be feeling right now with this?
He should pretty much be feeling some coolness, some very fresh, very moisturizing. Dime qué sientes ahorita. ¿Sientes?
Siente bien.
Bien fresco, ¿verdad?
Siente rico, sí.
What's he saying?
He says, se siente rico, which means it feels good.
The skin does look nice and moist now. It does not look as dry.
All right.
Is this safe for his eyes?
They're vitamins, so it's good for all over. Oxygen is very antibacterial, so it also helps with any kind of acne, any kind of inflammation that's on the skin. It pretty much helps to rejuvenate and restore the skin. So, we're pretty much doing very pure oxygen. We also have other options of oxygen, like the hyperbaric chamber, which is a full dome of nothing but pure oxygen for the body. ¿Cómo vamos? ¿Cómo te sientes?
Se siente bien.
¿Se siente bien? ¿Qué sientes ahorita?
Does PRP help to rejuvenate these scars?
¿Qué sientes ahorita? ¿Fresco?
Fresco, súper frío, la piel está como que está respirando.
He's saying that the skin feels like it's breathing, which is great because we're giving the skin nutrients and vitamins to kind of help it repair, and it's kind of giving someone water when they're very dehydrated. It's saving someone's life. So this right here is allowing the skin to repair itself, to bind itself, and just rejuvenate much easier. There are other doctors where you go to and they don't have oxygen facials to kind of help treat their skin. So these patients are having downtime for maybe 4 to 8 weeks. So by doing oxygen facials, we're almost cutting the downtime in half. Because imagine if he did this laser and he didn't do an oxygen facial or anything like this, he'll be very raw, very sensitive at home.
Do you apply any growth factor hormones to the skin?
Oh yeah, we are applying growth factors. We have bone marrow stem cells. We have vitamins from A to Z. So it's a nice proprietary concoction that we're creating here by Dr. Emer, which kind of helps to really soothe and heal the skin. It's a process, but we're lucky enough to have the patient's trust and allow him trust the process and get the results. He trusted the process with the peel and he loved his results, and now he's trusting the process with the laser. And then at home he's going to need to be using hydroquinone and retinol to kind of continue lightening his skin and to prevent any pigmentation from rising. So, ya cuando te vayas a una casa vas a necesitar usando el Cosmelan 2, porque el Cosmelan 2 te va a seguir aclarando la piel y suaveciendo la piel. Pero vas a empezar ya como en unas 3 semanas, 4 semanas. ¿Cómo vamos? Es rico, ¿verdad?
Sí. Ese es el oxígeno, ¿verdad?
Sí. Pone feliz esto, ¿verdad? El oxígeno.
Sí, pues yo tengo que hacer otro mañana.
Sí.
We have some Spanish.
La verdad, la gente no sabe qué más hacer que maltrate el rostro. Sí, pero pues si alguien tiene una piel, un poco dañada, que tuvo eso toda su vida, hay tratamientos que se pueden hacer para ayudarle a suavecer ese resultado, para ayudarle a las personas que tengan buen resultado de una nueva claridad. So, todo el mundo es diferente, hay diferentes opciones y siempre es bueno para, tomar resultados y hacerse tratamientos.
Is it Spanish as well?
That's not Spanish.
Oh, I don't think so.
¿Cómo se siente esto? ¿Ya no se está ardiendo mucho?
No.
Perfecto. I asked him if this is, if his skin's still hot. He's saying this is definitely cooling down his skin and reducing the heat and the sensation of sensitivity he had when he came in. And we already see the skin. It's already starting to lift and exfoliate. And if you zoom in really quickly, you could already see the new skin already forming. Like the forehead. There's little spots here that you show the skin already healing itself. Can this turn that? Look at this side. Yeah. Yeah, this looks perfectly normal, nothing out of the ordinary. We've definitely been all trained by Dr. Emer, so we're all, prepared to pretty much deal with any kind of post-laser type of treatment. So we're currently going to do a crystal fiber mask on top of the skin.
What is this for the many people joining right now, Jonathan?
We're currently applying pure oxygen onto the face. We applied some vitamins right before this, which is a vitamin complex from vitamins from A to Z that's going to help with repairing and rejuvenating the skin. Okay.
Because you're asking, he did have a CO2 ablative laser done yesterday. That's on our IGTV. He did have a subcision, Bellafill, TCA. We did multiple treatments for his acne scarring. Now, Jonathan, what are we doing?
So we're currently applying a stem cell mask that's going to help repair the skin and cool down the skin. This is currently feeling very cool on the skin and very cold. Dime qué sientes ahorita. Frío. Frío means cold. It means fresh. So this is definitely a good feeling to have when your skin's very, pretty much repairing itself. So we're gonna go ahead and apply some of the serum on the lip. Okay. Perfect. ¿Qué sientes? ¿Cómo vamos? ¿Se siente rico?
Mm-hmm.
Perfecto.
What are his next steps in post-care?
The next steps in post-care is pretty much to continue applying hyaluronic acid like Hyla B, growth factors from Refit Face from EMERAGE, along with some bone marrow stem cells, some silogen, which is a nice silicone occlusive. So it's about maybe 12 to 13 steps, but it's definitely worth the result.
That was another mask?
Yeah, I just want to make sure that he, really taken care of. And I'm going to do his neck as well. Just give him the extra love that we need to give our patients.
Are we doing any other treatments for our patients today?
We're going to pretty much let this sit on the skin for about 15 minutes, and then we're going to be doing some red light therapy. So make sure you guys stay tuned when we come back.